This is Joselle. Joselle is a 60-year-old woman who recently suffered a stroke and is experiencing weakness and sensory loss in her right arm and right side of her face. Joselle is about to meet with her PT and OT for a neurological exam to assess her difficulties, along with her daughter Maddie, who will be assisting her at home.
Hi, Joselle.
Yeah.
Hi, I'm Kat Davis. I'm a PT with the University of St. Augustine.
I'm Michelle, I'm an occupational therapist from the University of St. Augustine.
How are you guys doing today? What's your name?
I'm Maddie, Giselle's daughter.
Nice to meet you.
So today we want to assess the severity of your stroke. So to do that, we're going to do some strength testing. We're going to test your sensation and also your speech. Does that sound okay? Okay. And so in doing that, you might experience some discomfort. And if at any time you would like to stop, go ahead and just let us know, and we can take a break and come back to it at a later time. Does that still sound all right? Yes.
All right, Joselle. Before we get into some tests, I just need to confirm a few things. What's your date of birth?
June 3rd, 1959.
Okay. And then do you know where you are right now?
Hospital.
Okay. So after your stroke, right, is there anything that you're having trouble doing, like at home or anything like that?
Cooking, hard for me. Dressing up. So she's having difficulty taking care of herself, brushing her teeth, combing her hair, and I often have to dress her up to help her dress and do the things that she needs to do to get ready.
Okay. Because of that, Giselle, we're going to do a little bit of muscle testing to see how strong you are. Is that something you're okay with?
Yes.
So, to start here, can I have you try to raise your shoulders up to just like this? All right. Hold this one up. Doing okay? Can you hold it right there for me? And we're going to bring it forward here. All right, I'm going to try to pull you towards me. Don't let me, okay? Can you hold it there for me?
The findings of this test were that Joselle has right-sided hemiparesis, and that the left side is normal strength.
All right, Joselle, we're going to do a little bit of a test to test your sensory, see how you're feeling. I just have this little pin here, and one side's sharp, and one side's dull. And go ahead and just lightly touch you with the sharp side or the dull side, all right? And I want you to tell me if I'm touching you with the sharp side or am I touching you with the dull side. That makes sense?
Mm-hmm.
So before we start, I'm going to try this on this side here, okay? Go ahead and look. This is what the dull feels like. This is what the sharp feels like. Go ahead and close your eyes for a second. Tell me, what is this?
Dull.
And which one is this?
Sure.
Okay, good. All right, we're going to move on to the right side, all right?
Sure. 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 Dull. Sharp.
We're doing on your arm now.
After completing the entire test, the PT determined that Joselle has intact primary sensation bilaterally.
Sure. All right, Giselle. Today we're going to test your language. Can you go ahead and repeat after me? No ifs, ands, or buts. No ifs, buts, and buts. All right, and now can you repeat? Today is a good day. Today good is a good day. Thank you.
After this test, the OT determines Joselle has difficulty expressing her words, also known as Broca's aphasia.
All right, Giselle. So now we're going to do a test called stereognosis, and what I'm going to do is I'm going to draw letters and numbers in your hand, and I want you to tell me what they are. Okay, so let me see your hand, and can you go ahead and close your eyes for me?
I don't know. I don't know.
All right, I'm going to try the other hand.
Oh. 3.
Okay, thank you.
After performing this test, the OT determines that Giselle could have an impairment with her cortical sensation.
All right, Giselle, so we're going to do another test. I'm going to have you close your eyes and then indicate where I'm touching you. Does that sound okay?
Yes.
All right, so go ahead and close your eyes.
Left arm. Knee. Left side. Left shoulder. Hand left.
After performing this test, the OT determines that Giselle's cortical sensation is impaired.